I want you to pause this video right now. Walk over to a mirror and pull your lip down. Look closely at the base of your teeth. Do some of your teeth look longer than they used to? Can you see a slight color change where the crown of the tooth meets the root? Does that area feel sensitive when you drink ice water or breathe in cold air? If you answered yes to any of those questions, your gums are shrinking, and you are not alone. A massive 2025 systematic review of over 37,000 people found that a staggering 81% of the general population has some level of gum recession. Let that sink in. 8 out of 10 people watching this video right now have shrinking gums, and nearly half of them have moderate to severe recession that is actively putting their teeth at risk of falling out. But here is the terrifying part. Most people don't even realize their gums are disappearing until it is almost too late. They think their teeth are just naturally getting longer as they age. They think the sensitivity is just a normal part of getting older. They ignore the slight bleeding when they brush. They don't realize that their gum tissue is literally dissolving, exposing the vulnerable root of the tooth and destroying the bone that holds their smile together. The internet is full of terrible advice on how to fix this. People will tell you to scrub your gums with baking soda, or swish essential oils, or use harsh whitening toothpastes, but those things will actually make the problem worse. Today, we are going to look at the real, scientifically proven reasons why your gums are shrinking. We are going to uncover the silent habits that are destroying your gum line while you sleep. And most importantly, I am going to give you the exact evidence-based steps you need to take right now to stop the recession in its tracks and save your teeth. And I promise you, the fourth cause on this list is a daily habit that almost everyone does, thinking they are helping their teeth when they are actually erasing their gums. I'm Dr. Foxy. Let's get into it. The absolute number one cause of shrinking gums, the undisputed heavyweight champion of tooth loss, is periodontal disease. That massive 2025 study I mentioned earlier, it found that people with gum disease have nearly 10 times greater odds of experiencing severe gum recession. 10 times. It starts silently. You miss a spot while brushing, or you skip flossing for a few days. Bacteria in your mouth mix with proteins and food byproducts to form a sticky, colorless film called plaque. If that plaque isn't removed, it hardens under your gum line into tartar, or calculus. And once tartar forms, you cannot brush it away. It is like concrete glued to your teeth. This tartar is packed with aggressive bacteria. Your immune system senses this bacterial invasion and launches a counterattack. It sends white blood cells to the area to fight the infection. This causes your gums to become red, swollen, and prone to bleeding. This is gingivitis. But if you ignore the bleeding, the war zone escalates. The chronic inflammation doesn't just kill the bacteria, it starts destroying your own tissue. The inflammation literally dissolves the gingival tissue and the underlying bone that holds your teeth in place. As the bone melts away, the gum tissue follows it down the root of the tooth. The gums pull away, creating deep infected pockets, and the recession becomes visible. If your gums bleed when you brush or floss, your gums are actively under attack. Bleeding is not normal. It is a cry for help from your immune system. If you ignore it, the recession will only get worse. But what if your oral hygiene is perfect? What if you floss every day, your gums never bleed, and you still have shrinking gums? That brings us to the second hidden cause. Now, after gum disease, the second major cause of gum recession is something most people never even consider. And it has nothing to do with how you brush or how often you floss. It is the alignment of your teeth. When your teeth are lined up correctly, every time you bite down, the force travels straight down through the tooth and into the bone exactly the way it was designed to. Your teeth can handle enormous vertical force. That is what they were built for. But when your teeth are crooked, crowded, or out of position, those forces hit at an angle, and your teeth were never designed to take force at that angle. And this is where most people completely miss what is happening. Every single time you chew, every single time you clench, every single time you swallow, and you swallow over 2,000 times a day, Those angled forces are transferring into the bone and the gum tissue surrounding that misaligned tooth. It is not a one-time event. It is thousands of micro traumas every single day for years. And this is the part nobody tells you. That constant misdirected pressure causes the periodontal fibers, the tiny ligaments holding your tooth in the bone, to overstretch and break down. The bone responds the only way it knows how. It resorbs. It melts away to escape the force. And once the bone drops, the gum follows it right down the root of the tooth. This is why I tell my patients all the time, get your teeth straight, because if we do not fix the alignment, we are going to keep destroying those gums no matter how perfect your hygiene is. A 2016 study in the Dental Press Journal of Orthodontics confirmed exactly this. They found that teeth affected by occlusal trauma from misalignment develop a characteristic V-shaped bone loss on the outer surface of the root. And the gum recession follows that exact same pattern. And here is the key. This damage happens without any infection, no plaque, no bacteria, just pure mechanical destruction from forces hitting at the wrong angle. Now on top of that, if you are also grinding your teeth at night, that is bruxism, you are adding hundreds of pounds of additional lateral force onto teeth that are already taking hits at the wrong angle. Bruxism is heavily linked to stress. When cortisol goes up, grinding goes up. So now you have misaligned teeth getting hammered all day by normal function, and then getting crushed all night by grinding. It is a double hit that accelerates recession faster than either one alone. The scary part is that most people have no idea this is happening. You might wake up with a sore jaw or a dull headache and never connect it to your shrinking gums. But here's the part that is even worse, because this next cause, you are doing it every single day. And this one is completely in your control. Everything we just talked about, gum disease, misaligned teeth, grinding, those are things happening to you. This next one, this is something you are doing to yourself every single morning and every single night. I call it the grout tile mistake. You know how people scrub bathroom grout? Tight grip, hard bristles, back and forth like they are trying to sand the tile clean. That is exactly how most people brush their teeth, and it is quietly erasing their gum line. This is a catastrophic mistake. Your gum tissue is delicate. It is not enamel. It is soft, vascular tissue. And when you aggressively scrub across the gum line, you are creating repeated mechanical trauma. Over time, the gums simply retreat to escape it. They don't fight it, they just move away. The tissue wears down, the roots become exposed, and sensitivity starts creeping in. If you notice that recession is worse on one side, especially opposite your dominant hand, that is a major red flag. It usually means you are brushing too hard on that side. And this isn't just theory. An 11-year study published in the Journal of Clinical Periodontology found that people using electric toothbrushes had 22% less gum recession than those using manual brushes. Why? Because electric brushes remove the scrubbing. They use micro vibrations. Many have pressure sensors. They force you to glide instead of grind into your gums. So if you are still using a hard or medium manual brush, it is time to let it go. Now here's where it gets frustrating. Even if you fix your brushing, control grinding, and stay consistent, some people still experience recession. Now before we move to the fourth and final cause, which is purely biological, I want to make this as easy as possible for you. I've put together a free one-page gum recession prevention checklist that summarizes everything we're talking about today. You can grab that, along with my recommended toolkit, at the link in the pinned comment below. And that brings us to the fourth cause. This one is biological. The fourth major cause of gum recession disproportionately affects women, and it has nothing to do with how well you brush or floss. It is all about hormones. Your gum tissue is filled with hormone receptors, so when your hormone levels shift, your gums respond. During puberty, increased hormones increase blood flow, leading to swelling and sensitivity. During pregnancy, progesterone spikes and makes the gums hyperreactive to plaque. That is why pregnancy gingivitis is so common. But the most significant shift happens during menopause. As estrogen drops, two major things happen. First, saliva production decreases. That leads to dry mouth. And without saliva, bacteria multiply faster, accelerating gum disease and recession. Second, bone density can decrease. And just remember, your gums follow your bone. If the bone weakens, the gums recede with it. So if you are going through hormonal changes and noticing gum changes, it is real, and it needs to be addressed early. Now that you understand what is actually causing your shrinking gums, here is what you need to do next. You cannot regrow lost gum tissue with a magic toothpaste, but you can absolutely stop it from getting worse and protect what you still have. Step 1. Upgrade your hardware. Switch to a high-quality electric toothbrush with a pressure sensor. Use a soft or sensitive head. Hold it at a 45-degree angle and glide. Do not scrub. Step 2. Support your tissue. Your gums rely on collagen, and collagen depends on vitamin C. If you are deficient, your gums weaken. So make sure you are getting enough through your diet or supplementation. Step 3. Fix the foundation. If your teeth are crooked, crowded, or out of alignment, those forces are hitting at the wrong angle every single time you bite down. Talk to your dentist or orthodontist about getting your teeth properly aligned, whether that is braces or clear aligners. And if you are also grinding at night, get a custom night guard. Not a store-bought one, a custom one that protects your bite and absorbs those forces. Step 4. Control the bacteria. Floss daily or use a water flosser. And if your gums are bleeding, that is infection. You need a professional cleaning to remove tartar below the gum line, because you cannot remove that at home. Gum recession is not random. It is a warning sign. It is your body telling you that the foundation of your teeth is under attack. But if you take action now, if you stop the trauma, control the bacteria, and protect your gums, you can stop it and keep your teeth long term. I want to hear from you. Which of these 4 causes surprised you the most? Or have you noticed your gums changing and you didn't know why? Let me know in the comments below. I read as many as I can. If you found this video helpful, make sure to subscribe so you don't miss our next deep dive into saving your smile. I'm Dr. Foxy. Protect your foundation, and I'll see you in the next one.